Diabetes is one of the biggest epidemics in our society today. It is caused by many things like obesity, genetics, ethnicity, or even childhood viruses. Diabetes is the failure of insulin produced by the pancreas. Today, I will explain to you about the two types of diabetes, those being type 1 or juvenile diabetes and type 2 or adult onset diabetes. Also, I will explain to you how diabetes can affect every part of the human body and cause many complications if not taken care of properly. First, I will explain to you about type 1 or juvenile diabetes. Type 1 or juvenile diabetes, according to LifeMed Media Inc., is an autoimmune disease that occurs when the pancreas fails to produce insulin. Insulin's primary job is to help our body cells use glucose for energy. Blood glucose or blood sugar is manufactured from the food we eat and by the liver. If glucose can't be absorbed by the cells, it builds up in the bloodstream instead. The demographics for type 1 diabetes is this. Type 1 diabetes is most common in Caucasians, but is equally found in males and females. This type is also usually found in most children. As a matter of fact, 1 out of every 400 to 600 children are diagnosed. The treatments for type 1 diabetes are insulin shots, as well as exercise and healthy eating. Another type of diabetes is type 2 or adult onset diabetes. Type 2 or adult onset diabetes, again, explained by LifeMed Media Inc., states that this type of diabetes is the most common form of the disease, accounting for 90 to 95% of all type 2 diabetes cases in America. According to Christine of Glucomanu, most people with type 2 diabetes are still able to produce some insulin. However, the insulin they make cannot perform properly their primary job, as mentioned earlier. Although the majority of people with type 2 diabetes are adults, children and adolescents are at an increasingly for risk for the disease. The treatments for type 2 diabetes are prescribed medication and in some cases, insulin. Also, exercise and healthy eating, as well as blood sugar testings. Consequently, if your diabetes is not taken care of, it will cause many complications. These complications are explained in LifeMed Media Incorporated, which says that if diabetes is not treated right, it can cause many serious complications and it can affect every part of the human body. Nerve damage impacts up to 70% of people with diabetes. In fact, the biggest risk factor for developing nerve damage is uncontrolled blood glucose levels. Diabetes is the #1 cause of chronic kidney failure in the U.S., and kidney disease among people with diabetes has more than doubled in the past decade. Cardiovascular disease is the leading cause of death among people with diabetes, yet much of the population remains unaware of this risk. Hyperglycemia, or high blood sugar, can cause arteries to narrow and or lose elasticity, and high cholesterol levels can clog arteries with fatty deposits. The eyes are also affected with diabetes. Diabetic retinopathy is the most common serious visual complication associated with diabetes. It occurs when the blood vessels leading to the retina of the eye become blocked and leak fluid or blood into the eye. According to the National Institutes of Health, diabetic retinopathy causes 12,000 to 24,000 new cases of blindness each year. Dry skin problems and gum disease can be caused by diabetes as well. Nerve damage of the feet or foot ulcers and Charcot foot are just a few of the potential diabetic problems with the foot. To lower complication risk of diabetes, every part must be controlled. You must know your blood pressure level, your cholesterol profile, and you must know your A1C. And the A1C is the average of your blood glucose level, and it's usually checked in every 3 to 6 months. You can live a normal life with diabetes if it is taken care of. Diabetes can be beaten.